the 2023. And I think the first order of business is to introduce our new interim health director. And Elizabeth, just give us a thumbnail sketch of who you are and how you came into this position so that they'll understand. Probably many of them have not met you.
So I'm Beth Robinson. I have been the Deputy Health Director for a little over a year, well, about a year and 6 months probably now, right under Alicia. And once Alicia decided she was going to move on, they asked me to be interim, and I have a clinical background in radiology. I have worked with Linda. I don't know if she remembers me out back in Copper Queen. I've been in Cochise County off and on since '89. I have plenty of connections throughout the county. I think I've worked at almost every hospital besides Benson in the county. And I haven't worked at Chiricahua, and now I boycott them because they took Alicia. Just kidding. But other than that, I just got my doctorate in global health, and I have my master's of health administration and a radiology license also. So I really like public health. I like it better than clinical services, honestly, because I don't like to patient count and make people tons of money. I rather take care of them and prevent them from having to go to the hospital before it gets to that point. So that's me in a nutshell, really.
Well, and welcome.
Thank you.
Not only to the Board of Health, but to Cochise County, and being the interim director, I know that you'll move us forward. Are you going to be introducing each one of the health department speakers?
Yeah, we can. I can as they go along. Yeah.
Okay, so we'll turn it over to you.
All right. So, like Supervisor English said, this is the Board of Health meeting, June 9th, 2023. Welcome, everybody. And of course, it's going to do this to me now. Come on. Really? Oh, there we go. So here's our agenda. Most of you got it. I know, Linda, you said it hasn't come through for you yet, but we have a lot to talk about in a short amount of time, but just some updates of our divisions here. Welcome and introductions. There's a ton of people on the phone. I wasn't prepared for that, but a lot of them are from our department. Steph, I think you're on the phone, correct? Or online?
I am on MS Teams and with you, can hear you, and am connected.
Perfect. I think Evelyn, who is a board member, is on the phone or on Teams. Lanny, who is a board member, is on the phone. Linda is on the conference call. What other board members are? I think that was it, yeah. So, Daniel, are you?
Yep,
Daniel
I'm here.
is our epidemiologist. He also just finished his PhD from U of A. So congratulations, Daniel. And let's hear some COVID and flu RSV updates.
All right, sounds good. Thank you. So yeah, I'm going to go over not only our current COVID situation, but also I wanted to touch on the flu data because we've had a little bit of a spike this past week. But just briefly, with the end of the COVID emergency, a lot of our specific data is no longer being collected. But I do have some metrics that I can continue to share in those weekly MMWRs that I send out. Next slide. So this is data over the past year. The orange bars represent our cases, and the blue line represents our hospitalizations. You can see our cases are the lowest they've been pretty much over the entire past year. And we've had no hospitalizations the past couple weeks. However, looking at real-time data, we do have a couple inpatient beds that are filled with COVID patients. So we will expect to see a couple hospitalizations pop up in the next week's MMWR. Next. And this graph is over the entire pandemic. Again, orange bars are our cases, but the blue line now represents COVID-like illness. And you can see that COVID-like illness has been declining the past few months. the trend line has. But over the past few weeks, we are seeing a slight rise. And that could be attributed to other illnesses such as influenza and things that present similarly to COVID. Next slide, please. And for influenza, this chart shows this year's flu cases in the blue and our previous 5-year average of cases in orange. And that's what we would expect to see based on our 5-year average. And you can see that we had a really bad early flu season, but flu season should be ending right about now as the hot months start hitting. However, you can see that last week we did have 26 cases reported when we should have only seen about 7. And what was really interesting is 96% of those were influenza type B. So it'll be really interesting to see this current week data this week when it comes out next week to see if these case numbers continue to trend or if they start to decline again as the hot weather continues. And that's all that I have. I can take questions now, or please feel free to send me an email or in the chat.
Well, what's the difference between influenza A and B?
Between A and B, it's just the 2 different strains. Influenza A is compromised. It's going to be like your swine flu. Influenza B is I believe that only humans and seals can get influenza B. I'm not an expert on the different types and variants, but influenza B is typically a little bit more. We don't see it as often, but this past year we have saw it quite a bit more. And influenza B can typically be a little bit more severe than influenza A. When people generally refer to the flu, they're referring to type A.
Thank you.
Any other questions? All right, thank you, Daniel.
Absolutely.
So next we have Tommy Allen, who's going to speak about the end of the public health emergency and what the impact is on us at CCHSS.
All right, good morning, everybody from Clinical Services. You probably skipped the first 2 slides, Beth.
Okay.
All right, the end of the public health emergency was May 11th, 2023. The public health emergency part is over, but we are still offering vaccines. Treatments are still available, and testing is still going to be available as well. Next slide. Currently, Cochise County will still offer vaccines to children 6 months and older. We are only offering the Moderna vaccine. And right now, access to the vaccine is not an issue. We are looking for it to be commercialized this fall. But due to our standing with the vaccine for children and vaccine for adults, we still should be able to provide all these services for free to our community members. Next slide. At-home tests are not going to be covered by insurance for free anymore, meaning when you go to the pharmacy, they won't ask you if you want any free testing kits or anything like that. We do have a large supply here at the county health departments. If people want them, they are more than welcome to come in, and we will have them until we run out or those kits expire. All 5 sites, Benson, Wilcox, Sierra Vista, Douglas, and Bisbee have those. Next site. Treatments remain available at primary care providers. There is the medication if you test positive for COVID right away. Right now, it is up with the insurance companies determining how expensive that's going to be. So just if people call and ask, we want to send them to their healthcare providers for any information on that. Next slide. All right. Preventative actions. We want people to stay up to date on their COVID vaccines, improve ventilation, get tested when they need it, follow the recommendations. If you've been exposed, it is still wear a mask for 10 days. Watch for symptoms and get tested at least 5 full days after exposure. If you're feeling sick, please stay home. And if you are at high risk of getting very sick and need treatment, please contact your healthcare providers. Next slide. All right, they did make the COVID vaccines a lot easier. We only have the bivalent. It is 1 dose to complete the series if you have not been vaccinated, 1 dose of the bivalent to complete it if you've had 1 dose, and a booster of the exact same bivalent vaccine if you've had 2 doses and you are within 2 months of having those. Next slide. All right, if you guys have any questions, feel free to ask right now, or you can contact myself or Myra Ibarra, our Director of Clinical Services, at the numbers listed on here.
I have one question.
Hi, this is Evelyn. Oh, go ahead.
Go ahead.
Oh, well, my question is, so, and other people have kind of asked this question as well of me, and do we, so a lot of people have the 1 bivariant, and you said that it's recommended that you get a second bivariant booster, and so people have done that, but they're at their 6 month, like they've already passed their 6 month time. Like what is the frequency that you should be getting these vaccinations, or is it not has it not been recommended yet after that second bivariant immunization?
As of right now, Evelyn, it's if you've already had the bivalent booster, unless you are over 65, you do not need another one. With COVID vaccines, expect to see that change probably this fall. We don't really know what's coming, but for people over 65, you are supposed to be getting another bivalent booster.
Well, how often does that
Okay,
have to
thank
happen?
you.
Because the general information is not out there, and people keep asking, well, I've had what they told me to. Do I need any more?
That's a great question. For people over 65, they're recommending 1 more bivalent, and then there's no time frame for when they should get their next one yet. You know, unfortunately, we are locked into what the CDC is recommending, and they do change those quite often. So for right now, I can tell you that if you are over 65 and have had 1 bivalent and it's more than 2 months, you need another one. If you are under 65 and you've had a bivalent booster, you are up to date on your COVID vaccine.
Next question is, where will they go to get those? Chiricahua, the health department, the doctor? Will it cost them? Because those are the questions they'll ask.
So currently the COVID vaccine is still free of charge. It has not been commercialized yet. So right now the pharmacies and providers should be providing those free of charge. The county health department is going to continue to provide them free of charge, even if it is commercialized.
So I guess the doctor, Chiricahua,
Yep.
or here.
CVS, Walgreens, Walmart, all of those should still continue to carry the COVID vaccines.
Okay, thank you.
Steph, did you have a question?
Yeah, just is there a background coordinated kind of MARCOM happening between the 3 rural nonprofit hospitals, the Sierra Vista Regional Medical Center, the health department, and Chiricahua for public education, like a single kind of flyer or information that's kind of, you know, similar looking coming from everybody to the public?
There's not really, but Sierra Vista, the Canyon Vista is not a nonprofit, so
Right.
sometimes it's a little harder to work with them, but I know Chiricahua, Copper Queen, usually Benson, we all really kind of work together with, especially with the CCHA, and Kim can talk a little bit about the CCHA if you wanted to talk to her about that, with COVID and bringing out kind of the same message to the public when the public health emergency was going on. Now that it's gone, or now that it ended, I should say, we haven't really had, I would hate to say we haven't really had much collaboration, but we haven't done much about that together, no. I mean, and that is a good idea to maybe come out with a good message of when everybody needs to maybe get a booster or what the recommendations are at this moment.
Yeah,
As
that's
a
just
united
what
front.
pops into my head as a rural community person, that people get their healthcare information from pretty much, 4 or 5 different, maybe 6 different places, including the school superintendent's office. And if there was, kind of a document or, a marketing that showed like the health department and the nonprofit hospitals, the for-profit hospital, that everybody was kind of, sharing the same information, it would be really helpful, because then I think the public would see like, oh, this is the same, whether I'm in Wilcox or Douglas or Bisbee, or, whether it's coming from Chiricahua or the health department. So just a thought. I saw that happen in the early days of the pandemic, and I think it was pretty useful. And it doesn't have to be just, related to, the pandemic. It could be other public health issues too. Anyways, just a thought I had.
No, that's a good idea. So come as a united front. I mean, that's builds trust in the community, right? So that is a good idea.
And we would be willing to, U of A Cooperative Extension would be willing to, we put our name on it last time, and then we helped distribute it as well. So we'd be willing to do that again if that comes up, just to kind of keep it in your back pocket.
Okay. Thank you, Evelyn. Any other questions for Tomini? Thank you, Tomini. Speaking of Miss Kimberly Mitchell, she's going to speak about our FEP division and mainly about Title 42 and the updates for that.
Good morning, everybody. My name is Kimberly Mitchell. I'm the Public Health Emergency Preparedness Coordinator for Cochise County, and I'm going to go ahead and talk to you guys about our public health response in Title 42. So as Tommy mentioned, Title 42 ended on May 11th of this year. We held our first meeting with our hospitals on May 9th, so a couple days prior to the Title 42 ending. We provided some situational awareness, and when I talk about situational awareness, I'm talking about what numbers we were going to expect as far as asylum seekers, possible medical issues that could arise from seeing those asylum seekers, and what other counties have been seeing with medical issues, along with like release locations and any shelters that we could possibly have in our county. So on this slide right here, you guys can see at this time, all releases from our Border Patrol have been placed on hold. This means that we are not having releases, okay? But what this does not mean is that it will not happen again, okay? So I just really want to push it out there. It's on hold as far as releases, but it does not mean that we will not see it again. So right now we're continuing to prepare for it, and we're assisting our Cochise County Office of Emergency Management with it. Our Office of Emergency Management's #1 priority is to transport the asylum seekers out of Cochise County to either Pima County or Maricopa County, because they have the infrastructure for it. When I talk about infrastructure, I'm talking about they already have those overnight shelters. They already have medical staff in those overnight shelters. They have all the capabilities, and they've been running it for a while. So that's why we wanted to transport the asylum seekers out to those counties. If Pima, so another one was that if Pima or Maricopa County became overwhelmed with the asylum seekers, or transportation arrangements could not be made at the time of the release, then our Office of Emergency Management made arrangements with some local churches to open up as shelters to house and feed them until they could be transported out to those other counties, Pima or Maricopa. Now, if our shelter, if we intook some of those asylum seekers, if our shelters became overwhelmed, then we would have to do unsheltered releases. That would mean, yes, we would have asylum seekers on our streets. In those respective locations that you see right there, Naco and Douglas, or Bisbee. Fortunately, the transportation of the asylum seekers went seamlessly. We had no problems. So that was wonderful. It went really well. and we were very happy with that. The only devastating event that happened during the Title 42, which I'm sure you guys are aware, was that one of our shelters did burn down, which left us with only one shelter to utilize if we would need it. So we did have initially one shelter, and then another church said, hey, we would be able to do that, but now we're down to so on the very bottom bullet point, you can see here that Cochise County Health and Social Services, the public health, assisted our Office of Emergency Management in many ways. So we bought numerous cleaning supplies to help mitigate the spread of illness and disease in those shelters. And it really was, we put, some hard surface cleaner in there. We put some cloth sanitizing cleaners in there. We loaned them out for hot hand washing stations. We loaned out medical cots, which are a little bit bigger than those smaller cots that you get from Red Cross. And our environmental health division did inspections for those shelters as well. So we went in as a team and met with the shelter staff, and it turned out really well. We had good communication and good cooperation, and it turned out very well. Go ahead, next slide, please. Here, I just kind of wanted to give you guys an idea of a map of the overnight shelters in Pima and Maricopa County where the asylum seekers were transported to. The numbers under the shelter names, if you see like the end, it says 100. That number is the number of asylum seekers that can be housed there. Now, majority of the time, those shelters were at capacity during the surge that we saw in that 2 weeks that we had releases. They were surged. And they were housing more than that a number reflects right there. So Casa Alitas was well over 1,000 on those asylum seekers and housing them. And it was a very hard time for those that were working those shelters up there in Pima County and Maricopa County. There was a time where Casa Alitas was at capacity, over capacity, and our buses of asylum seekers were actually going all the way to Maricopa County. So it worked out well. It was stressful, not only just for us, but it was very stressful on our neighboring counties, Pima County and Maricopa County. Go ahead to the next slide, Beth. So on this slide, you're going to see that this is the locations and projected numbers of releases expected. You can see, obviously, we have no releases in Cochise County at this time. But in the very beginning, we were expecting 400 daily releases in Cochise County. That would be 200 in Douglas and 200 in Bisbee, with 100 in the morning and 100 in the evening. So it was we were expecting about 400 releases. Our last updated numbers for week 2, which is what we really ended with, was a total of 766 for the week of May 15th through the 19th. And those were our last releases within Cochise County. Next slide, please. Here is a graph that represents the Title 42 releases by location. Naco is in orange and green is Douglas, the city of Douglas. And you can see here that we tapered off pretty quickly towards the end. Right here on the 16th, we just really kind of like tapered off, which was really nice. But we did have that initial surge. Next slide. Next slide. Here we have the medical issues that Maricopa County was seeing once the asylum seekers were released to them. And the reason why we show this is because we really wanted to keep our hospitals informed on what they could possibly see. So right here, keep in mind that this is the last update and it does reflect the April numbers only. So you have medical neglect as the highest of 23 encounters. And medical neglect is defined as like a delay of medical care of an illness or ignoring medical recommendations by a doctor that they had seen, or simply just not seeing a doctor when they have an illness. So there was 23 there. And then the second highest is medications that removed, and that's at 15. And this means that they're not taking a medication that would help with the illness, injury, or the disease that they're experiencing. So in turn, they take those medicines away and they prescribe them the correct ones. And then the third highest we have is less than 30 days of prescription, and it comes in with 9 encounters. So it means that they would need more of their medication prescribed so they can remain healthy through their travel to their final destination. And then to follow, you have extreme psychological distress at 2. This is this is a pretty traumatic journey for some of them. And I know it's a very small number, but that small number does require some kind of mental health care, and they had to give them that mental health care. And then in the very last one, you have inappropriate pre or postnatal health care at 0. So they didn't see anybody in April for that. Next slide. So in here we talk about, on this slide, the medical needs that are being seen and the medications that are being removed in immigration custody. So you can see that high blood pressure medication is the highest on the graph. And I know it's really hard to see, but high blood pressure is our biggest medication removed. And then following that is diabetes medication, and then asthma and prenatal vitamins come right after diabetes, and then we have HIV positive medications being utilized. With all this being said, I can say that Title 42 did not surge our healthcare community in Cochise County. Our hospitals were definitely prepared for it. We had multiple meetings prior to Title 42 to really ask our hospitals if they were ready for this. Was their surge plans updated? And do they need to be tweaked, and do they need to go back to their executive team? So we were extremely thankful for this, even though our hospitals and our health, like I said, our healthcare stakeholders were prepared. We will continue to provide updates to our hospitals and our healthcare community when they come up. But at this time, Cochise County Office of Emergency Management and our public health staff here are on standby at this time. So that things have slowed down a little bit for us, which is good. Go ahead with the next slide. And that really concludes my presentation on Title 42. So if you guys have any questions, comments, concerns, you guys are more than welcome to call me, or you guys can simply send me an email. Sometimes I know after our wheels have started turning, we come up with more questions. So just go ahead and shoot me an email, give me a call, whatever your choice is, and we can discuss it. Thank you for attending today. Happy Friday, and enjoy your weekend.
Anybody have any questions about Title 42?
I mean, I do have one comment for the benefit of the Board of Health. Pima County has stepped up to work with Cochise County way before this all started to take place. And so I want you to be cognizant of the fact that they recognized right away that we had no resources here in order to help. And so Santa Cruz County really benefited from Pima County taking the high road, getting the money, offering the services, and helping. So wanted you all to realize that we didn't suffer any from this. You know, Pima County held us in their arms.
That is correct, Supervisor English. Thank you for pointing that out. They have been absolutely wonderful. All of our partners have been absolutely wonderful, and they have helped when the need was there. So I commend everybody.
All right. Thank you, Kim. Anybody else have any questions for Kim? Lou, are you on the phone or on the call?
I am, yeah.
Perfect. So Lou is part of our Justice Reinvestment funds, and she is there with Cochise Harm Reduction, and she was going to give they were going to give a presentation about exactly what Cochise Harm Reduction is and does.
Cool, thanks.
Do you have?
I'm going to share my screen.
Okay.
Yeah.
See. Oh, come on. I love technology sometimes.
Can you guys see that?
Yes.
Yep. Okay, awesome. So I am with Cochise Harm Reduction, and I just put together a little short presentation on covering our first year of funding from the Cochise County Health Department, which is the Justice Reinvestment Funds. So we put that contract into place May of last year, 2022, and just finalized our first year of funding. So I kind of want to cover who we are, our history, what we do, and then what we've been able to achieve, both on an organizational level and then also with the people that we're serving through the last year of funding with the health department. So Cochise Harm Reduction was founded in 2019 in Bisbee in response to unnecessary overdose deaths in the community. We started as a small underground needle exchange from 2019 to 2021. We were only serving Bisbee. We were providing a free source of intramuscular naloxone, nasal Narcan, and sterile syringes for folks who inject drugs. In 2021, legislation passed in Arizona that legalized syringe service programs, so it made our work be able to come above ground. That was SB 1250, and it afforded a lot of immunity to staff, volunteers, and then also people who participate in syringe service programs. So it became a lot safer for people to participate in our program. And we were also afforded the ability to get a lot more funding for what we were doing. So the health department approached us with a contract to basically replicate the services we had built in Bisbee across the county. And so from there, we were able to focus on expanding outside of Bisbee. And so we are a 501c3 nonprofit. And our mission is to simply improve the lives of people who use drugs in Cochise County through direct services, education, and advocacy. We developed into a mobile unit during COVID, and that allowed us to better reach our rural folks, especially in Bisbee. The community became much more decentralized here. So we switched to running a mobile program, and we haven't looked back. It's been super successful and allowed us to reach people in the most rural areas of the county. I just want to highlight a little bit of our organizational growth because this hasn't been possible without the support of the Cochise County Health Department. So most importantly, we've been able to purchase a much better mobile unit. So this is our van. This is what goes to Benson, Douglas, Bisbee, Sierra Vista, Wachuga City. We take it out 2 to 3 times a week. And so in the van, it's fully stocked with all the different kinds of harm reduction supplies that we give out. And, you know, harm reduction is a really broad, we use it very broadly, right? Food, hot meals, water is harm reduction, right? We have a number of people in this county who die from exposure. And every single person who dies of exposure in Cochise County is completely unnecessary death. No one needs to die a 5-minute walk from the Safeway, right? Where there's plenty of liters of water and things that people could be using to protect themselves from the sun. So we do food, we do hygiene supplies, we have water, we do safe use supplies. So we run a needle exchange, we distribute Narcan and naloxone, and lots of other stuff. We do fentanyl test strips. We have wound care supplies. We run a syringe disposal service. So we've been able to really clean up the county with a lot of syringe waste. We give out socks. We give out camping supplies. So we do tents and sleeping bags, tarps in the summer. So that's just a little bit of what we do. A lot of our services are, you know, people let us know what they need, and then we do the best that we can do to get those supplies to them. So having this mobile unit that can handle the dirt roads, gets pretty good gas mileage, and can store a lot of supplies has enabled us to really spread throughout the county and serve more people. So since our funding with the health department started, we've taken this van on over 150 outreach trips across the county, and we've served 9 different zip codes across the county. So those places were Bisbee, Sierra Vista, Benson, J6, Hereford, Huachuca City, Pierce, Douglas, Naco, and McNeil and Elfrida. So there are some areas of the county that we haven't yet served, but we operate a phone number that we put on lighters that we distribute, that we put on informational materials that we distribute, and that's going to be the main way that people get in touch with us is over text or call. So people request services, and then we fit it into our routes. We have fixed routes every week of the month. We go to certain places. People expect us, and that's going to be the other way that new people engage with our services is through coming with friends. So referrals from other participants. We've been able to hire key staff. We have been able to hire an outreach coordinator to coordinate our outreach program, a chief financial officer, and a peer distribution lead who works on coordinating our peer distribution program, which is a program that creates low threshold part-time employment for people who use drugs in the more rural reaches of our county that we can't get to on a regular basis. Those people serve as distributors of Narcan and naloxone and other safe use supplies. So when people are in need of those supplies in Whetstone, Huachuca City, places that we're not able to get to every week, we have someone there that basically has storage of this stuff at their home and is able to supply people. So some people call that secondary distribution. And then in addition to those program leads that we've been able to hire, we've also created 11 small part-time employment positions with the organization. These positions have been aimed mainly at employing folks who are unhoused, disabled, or who are in active drug use. So folks who otherwise are generally barred from a lot of employment opportunities. And so that's been a profound way that we've been able to impact the community is by creating employment for these rural folks. We now have a brick and mortar office space that we just moved into less than a month ago. So we have more of a centralized location for people to come to and also for us to centralize our efforts out of. And we now have a full-fledged website. So I just want to cover a little bit about what are our goals and what are our activities as an organization. And then I'm going to share with you guys some of our data from the last year and what we've been doing across the county and what we've been seeing. So our four goals as an organization is to reduce overdose occurrence and fatality. And we do that through distributing Narcan, naloxone into the community and educating people in how to respond to an overdose, how to prevent an overdose, and how to recognize an overdose. We also distribute fentanyl test strips into the community so that folks can test their drugs for fentanyl. If they're not intending to use fentanyl, it can be extremely dangerous because it is such a high potent opioid. Our second goal as an organization is to decrease rates of infectious disease among people who use drugs. And the ways that we do this are distributing sterile injection equipment, sharps containers for proper disposal, safe use supplies, wound care supplies, COVID test kits and masks, hygiene supplies. We provide a syringe disposal service, and we have just started a program to provide rapid testing for HIV and hepatitis C out in the field while we're doing deliveries. Our third goal is to increase access to the continuum of care for people who use drugs and unhoused individuals in the county. And the way that we have been doing this is building relationships and rapport with our participants, providing referrals, and collaborating with our other organizations to bring as many different services into the field to our participants as possible. And our fourth goal is to increase low threshold employment opportunities. And we've done this through our peer distribution program, which again offers part-time employment to people to distribute Narcan and other harm reduction supplies in the most rural reaches of Cochise County. Our services that we offer, this is a little bit about, this is kind of what we provide on social media. So it shows people who we are, what our schedule is. We run a really fixed, regular route. And this has been, we've gotten a lot of feedback on this. One, people know how to reach us because we're so reliable. And two, it provides some amount of semblance of structure for people who are often living extremely chaotic lives. They know, you know, hey, it's Wednesday. I'm going to see the harm reduction folks today. And so this is just like an overview of all the stuff that we do. We do all the harm reduction supplies that I've listed above. We do hot meals, we do bag lunches, and we do non-perishable foods like commodities. We do camping gear, and we are starting to do confidential rapid HIV and hepatitis C testing, both in the field and also at some testing events that we've been doing. We provide at-home rapid COVID tests, masks, and vaccination, different kinds of harm reduction education in how to use safer, how to use naloxone, how to dispose of syringes properly, how to decrease the risks of abscesses or the risks of contracting hepatitis C. This is all the kind of stuff that we're talking to people about and educating people on. And then we offer legal system advocacy and support, and of course, referrals to other services and treatment across the county. And again, here's kind of like our mobile, this is our mobile delivery hotline basically, and that's a big way that people get in touch with us. So I'm just going to run through some of our numbers from the last year and what we were able to accomplish. We distributed over 900 Sharps containers. We don't have a number on this, but a large proportion of those were also returned back to us full. We distributed close to 125,000 sterile syringes. I think to a lot of people this seems like a high number, but for some people that use drugs, they might be using 10 times a day. And in order to actually eliminate hepatitis C and HIV in our county, we need to ensure that every time they're engaging in use, they're using a sterile syringe, a sterile needle, and all the works are also sterile. So the cottons that they're using for filtering, whatever they're using for mixing, hepatitis C can live in any of that. So we need to make sure, we need to give people the proper amount so that every time they use, they're able to be safe. Over 2,000 injection kits were distributed. So here's our work on overdose occurrence and fatality prevention. If we give out both nasal Narcan and intramuscular naloxone, they're the same medication, they're just delivered in different ways. The nasal is much preferred by people. It's much easier to use. Many of the people who are overdosing today have never injected a drug in their lives. Primarily, fentanyl is being smoked. So when people overdose, it's often from smoking. It's not from injecting. So people, the intramuscular naloxone is something that you have to load it into a syringe and inject it into a muscle. And a lot of people are just not comfortable with doing that. So we try to provide as much of the nasal medication as we can, because we do hear stories and testimonies of folks being around someone who overdosed. They have the intramuscular naloxone and they know how to use it because we've trained them in how to use it, but they still feel nervous and scared on how to use it. So we work really hard, specifically with the Cochise County Health Department, to provide as much nasal Narcan into the community as possible. So between these two numbers, we've distributed in a year close to 10,000 doses of naloxone. And so the other really important number on this screen is the overdose reversals that have been reported back to us. So this is reports of folks using Narcan or using naloxone. So we've had 127 reports. That means that we've had over 127 lives that have been saved through our program. This is a small number. There's also a ton of overdose reversals that aren't getting reported to us. So this is just a fraction, but it's still 127 lives saved, and that's 127 people that are still alive in Cochise County. So that's, I think, really representative of like the good work that we've been able to do. We've done 190 naloxone trainings, so 190 people have gotten trained in how to use both nasal Narcan and the intramuscular. And we've distributed over 5,000 fentanyl test strips. Our work with infectious disease prevention, 2,600 wound care kits distributed, over 450 COVID test kits distributed. We have done some work with the Cochise County Health Department collaborating on bringing vaccination services out to our participants, specifically the COVID vaccine. So in the last year, we've been able to provide 46 different vaccinations to folks. And then we've just started rolling out our own testing program. And so these numbers are really small because we've been doing it for about 2 months. So we've been able to do 32 HIV tests and 10 hepatitis tests. And then COVID consultations, this is folks who either have COVID or who have been exposed to COVID, asking for harm reduction education on COVID. And then our street outreach efforts, we've made 250 referrals to either treatment services, food services, doctors, just any other social services. We've distributed close to 2,000 meals in the last year. A lot of these meals are primarily going to folks who are living outside. Over 1,700 hygiene kits, and over 400 people have received camping supplies through us. So that's either tents, tarps, sleeping bags, or anything else that we get donated. So this is just me highlighting where are really out of those numbers, what are our measures of success? And so we've had over 4,000 engagements in harm reduction services with people who live in Cochise County. Again, 250 referrals. I already kind of went over all this, but this is just highlighting kind of like the important pieces where we really see our success shining with the data. And this is the last bit of data that I'm going to share, but it's just going to kind of show like what populations are we serving in Cochise County. So here, yeah, we have over 4,000 engagements with our services since May of 2022. And we've interfaced with 688 new people in the last year. So those are all folks who have received a lot of education in harm reduction services, and how to use naloxone, how to prevent an overdose, and also lots of referrals. So anytime someone comes into our program and is a new participant, they're getting all of that education, all of those referrals, all of that information. This is some graphs of how our participant base varies by racial identity, overwhelmingly serving white people, but second we have Latinx folks, then Black, Native, and Asian. Here is a graph of how our participants range with age. So primarily we're reaching people in the age group of 31 to 45. And then our second age group is 46 to 60. And then we do see some folks in their 20s and some folks in their 60s, but less so. And then gender identity, about 2/3 of our participants are men, and about 1/3 are women. And then we've had a small fraction of transgender and non-binary identifying individuals use our services. We have just a few testimonies because I think they can speak louder than the numbers. So these are different testimonials from people who participate in our services. It has helped improve my hygiene and appearance. I know I can always trust you guys are going to show up for supplies. I've had to use Narcan on friends. Without you guys, I wouldn't have had it on hand. It helps me knowing someone is actually there to help me. I've been treated like I'm actually a person and that my life matters, even though I use drugs. This program is really helpful for any assistance that we the people need in life who have nothing left. And since I've started my job working for Cochise Harm Reduction, it has changed my life. I can actually help others, helping them be safer and have items that make a huge impact in their lives in order to survive. So that is everything, I think. And then again, of course, thank you to everyone thank you to all of our partners and funders who make this work possible. So I would love any questions or feedback from anybody.
Thank you, Lou.
Yep.
Anybody have any?
What percentage of your funding comes from Cochise Health Social Services?
Sorry?
I say, what percentage of your funding comes from the Cochise County Health Department?
Maybe 20%.
Yes, Seth.
I just like practicing using my digital hand occasionally. Hey, I'm not sure I've met you before, Lou, but do you attend the CARP meetings, the Cochise Addiction Recovery Partnership? It's usually led by Chief Fullen.
I haven't been able to attend many this year, just because my schedule has gotten so busy, but they're on my calendar, and I actually have a new staff who's going to be attending regularly because I do want Cochise Harm Reduction to be there on a regular basis. I just haven't been able to attend myself.
Okay, great. Yeah, I had attended those when I was at U of A with Evelyn as part of the Building Healthy Communities. I still try to attend, but it's a pretty neat connection and collaboration between social services, the health department, law enforcement. They usually have some outside agencies come in from Pima County, and I think it seems like a good, strong group of people that could be great partners for you all.
Absolutely. Thank you.
Yeah.
And Evelyn, did you have your hand up?
I do. I'm raising my hand. Hey, thanks, Lou, for that wonderful presentation. And maybe I had missed it, but I have a question about, getting some of them into maybe some counseling services. Do you provide that? Maybe you can speak to that a little bit more.
We don't provide counseling or peer support services right now, but we do a lot of referrals to CBIS, HOPE. It kind of depends on where we are in the county, on where we refer folks, but we do a lot of behavioral health referrals. Behavioral health is probably our largest referral, our largest portion of referrals. But at this time, we're not offering formal counseling. We offer a lot of harm reduction education, which a lot of folks are not going to get anywhere else. So that's kind of the extent of our counseling, is the educations that we do in the field.
Thank you.
Mm-hmm.
Anybody else? Thank you so much, Lou. That was great. That's great work that you guys have been doing throughout the county. We really appreciate it. I know I do with friends that have been suffering from addiction. I appreciate it for sure.
Yeah, we appreciate you guys. Thanks for having me here today.
Thank you. All right, let me share my screen one more time here. And all right, so can you guys see that? Should say project in the works.
Yep.
Okay. Is it in presenter mode or in slide deck?
It's in slide deck.
All right. See, this is what happens when you're not here, Alex. Okay, well, so projects in the works, we have a lot of projects going on. These are some of the bigger ones. We have the strategic planning with the government solutions, and Seth, who is one of the newest Board of Health members, has graciously said that he is willing to help us with our strategic planning and be one of the board members that helps guide us through strategic planning. And then if any other board member would like to be a part of that project, we welcome that. One of the things with accreditation is that we have to have Board of Health members help us with the strategic planning and where we're going with the department. So contact me. We're going to start that process in the next couple of weeks. We're going to have a meet and greet with Government Solutions. Yes, Sep. Don't back out now, Sep.
I'm definitely not backing out. I'm just going to mention, and maybe this is already conversations happening, that I had an opportunity to work very closely with Evelyn at U of A Cooperative Extension, and happen to know she has a phenomenal amount of background in history with the health department and these plans. And if she has not already sent an email, I would she would be an amazing person with historical knowledge and experience in this area. And I definitely am all on board, ready and willing. But I just happen to know, after working with her, she has quite a background in this that would be incredibly helpful.
Yes.
Wow, now I need to deflate my head a little bit after that. I was actually going to just email Beth and go, hey, I'll help you out with that. So yeah, I would love to be on that.
Oh, perfect. Perfect. So we'll get a meet and greet, and we're going to send that out to some of the employees and see if any of the employees want to help out with the strategic planning process also. The next thing we have is we're planning a behavioral health or a mental health summit at the end of the year, and we're working with some different people around the county within like the sheriff's office, and we're just going to come together as a county and figure out where we are mental health wise, like what do we need, where are we lacking, what are the gaps, and we're planning that for November, and hopefully we're going to have that in Douglas. SEP has actually been helping us plan, get the plans going for that. So we might be reaching out to some of you to help plan that meeting and get that going also. Community health assessment and the community health improvement plan, that's still ongoing. We've been meeting every month about those, and we're starting to get the community's input and send out the surveys. So if you get any of the surveys, we're doing a snowball sample, and so we're going to ask you to send it out to any of your partners. Visible Network Labs, it's a network analysis. We are working with an intern out of the U of A. Her name is Jamie Chapman, and she's going to help us put that together. That is very new, starting last week. Workforce Development 2.0, that just got approved by the board. Thank you very much. And we're waiting for the state to come back and give us a PO on that before we can kind of divulge what we're going to do with that money. ClearPoint is our project management system. We haven't inputted anything into that yet, but we are working with the company ClearPoint to get a project management system up and going on the website so that everybody in the department can enter what they're doing and their projects and what kind of goals or action goals that they're reaching towards and what kind of improvements or steps they're taking at whatever time of the year. We're having a flu pod. The clinical services are putting together a flu pod in October. And then it is budget season, and everybody loves budget season. So that's sarcasm, I'm sure. But we are working hard with our budgets, and I think we are pretty close to having everything wrapped up and turned in for Juan and his team to take over from there. Other than that, are there any concerns from the board members? Any questions?
I just want to mention to whomever is on the line today that that health department is in sort of a stressful or very stressful situation with the board of supervisors, based on the fact that we promote wellness and we promote people having access and we listen to the CDC and not local or TV information. And so the health department has been sort of strangled with different situations. And I'd like for each one of you as Board of Health members to realize that you have a part to play and help them to reach the goals. Primarily, this health department is not fed and watered by Cochise County taxpayers. You know, we rest on the federal government in order to provide the vaccination services and the services that we do provide. They really do not come from our taxpayers. But we still need to uphold the health department so that it seems valid. And I'm not saying that you are not, but I'd like for you to look for other ways, maybe to put some pressure on the other board members about the validity of a health department, the validity of the services that we offer, the fact that we try to keep people healthy rather than being a hospital-oriented organization. And so it comes and goes at the board, but it's always there. And every time they step in front of us, they don't know if they're going to get something approved or not. And so I guess I'm asking you all to, in your little world, is there any way that you can make an impact to help the other two board members to understand the importance of the Cochise County Health Department and the necessity to keep it funded in every way possible? So that's just my take on it, and I hope that you'll find some way to act on that. Any other board members have any concerns or comments?
Hi, it's Lanny. I think the program this morning was excellent. The harm reduction I had not heard of before, and it's very impressive. With respect to the Board of Supervisors, we most definitely need to support those members of the board who have a positive feeling towards the health department, because we do a great job. And I think we all know the politics involved with some of our supervisor members. So hopefully we can bring colleagues and so forth when pressure is needed, and I'd be glad to help.
Evelyn or Sep, you guys can arm wrestle. Who wants to go first?
Go ahead, Evelyn.
Oh, I was thinking Sep had his hand up first, but I'll just pop up. It's probably Sep probably has like 50 million great ideas. I was just wondering, I know that as a board we have written letters to different entities, and perhaps a letter might be helpful from the board, just like a general blanket letter saying, you know, these are all the services, and you know, we find it very valuable to you know, to have our health department in our community. Maybe the question that I have is there some sort of, because I kind of got the feeling like there's like some sort of question to the validity of having a health department. Is that in question, or, you know, like, I don't know, that was just something that kind of popped in my head.
I think the basis of their concerns are mostly political, but you know, when you have a board member that consistently says, you know, I want us out of the vaccination business, I mean, that's kind of like where we started, you know, is trying to keep little children healthy and offer vaccinations, and certainly we've expanded a lot of services, but they look at it at the health department, the other two board members, as very susceptible unless it's offering something for them. That's just my opinion.
Okay, thank you. I might be eating lunch with some people.
I'll just jump in real quick. I really appreciate your concerns, and I concur with you, Anne, that many voices are important to help people understand how important public health is in Cochise County, being a border community, rural, underfunded, many other things. So I absolutely concur with you and support what you just shared. And I'll just go back to, this idea that, many voices together are strong. And I think we have really strong allies and people in public health at Chiricahua, at Benson Hospital, Northern Cochise Community Hospital, Copper Queen, Canyon Vista, the Legacy Foundation, who, they're giving their updates all around the county and the millions of dollars that they're spending on public health and supporting education and public health programs, and medical providers, doctors and nurses and folks like that. And I go back to this idea of the, marketing and communication for COVID and other public health issues. I support and recommend that we really communicate and collaborate with those partners, and that when we approach or share or talk to people, we try to talk in one loud and unified voice about public health and about Cochise County. And I do think that there are people in all of those places I just mentioned that would very much support what you said, Anne, and concur, and that somehow bringing folks together is I think, a crucial element of that. And that's all I have to say about that.
Sip, I blend on to what you are talking about, and I think that one thing that strikes me in all the years that, I've been in the political arena or running for office, no one has ever asked me from the public or in any kind of a debate how I feel about the health department, or do you support the health department, or what do you think of our health department? You see what I'm saying? So it's never been highlighted, and I think that especially with the coming elections, that certainly is something that people should be asking that question if they really want the health department to be valid and to be aggressive and to do all the things they're doing now. You need to find candidates and find out how do they feel about it, because you don't want to keep. It really is demoralizing for this health department, I guess is what I'm saying. Is I see it in them. It's not me I'm concerned about. I mean, I know who I am and I know what I believe in. But when you have workers at Cochise County that sort of feel threatened by, I don't want to go to the board, because I don't know what's going to happen. Maybe that's something that the people online today could consider, especially the Board of Health members, is not financial support for candidates, but make sure that people are interested in how they feel about the health department before they're elected.
And would it help if I were to write a column, do we need a health department?
Can you say that one more time, Lanny?
Well, I write a bi-monthly column for the Herald Review and healthcare. And would it help if I were to take one of my columns and give the title, do we need a health department, and then explain some of the things that the health department does and helps out in terms of Cochise County service?
I think all positive things are good, Manny, and we never get enough positive out there. There are lots of positive things going on in Cochise County, and especially here at the health department. And you yourself didn't know about the reduction harm program that they are partially funding. So anytime we can get good information out there so that the public doesn't say, well, I don't get anything from the health department, to keep your neighbor healthy is important as keeping yourself healthy, Oh,
yeah. Well, Elizabeth, if you'd like to, I'll be glad to contact you, or you can contact me, and we can talk about it, and I'll get one scheduled for the Herald. I'll do a column on it.
Okay.
Do we need a health department? And the concluding sentence will be absolutely.
Okay.
Okay, any other concerns? I think I've talked too much.
I'm sorry, I didn't hear you.
I say, are there any other concerns? I've probably talked too much. Want to make sure that each one of us has an opportunity to express our concerns. If not, then I guess the next thing is to tell you that the next Board of Health meeting will be September the 8th, 2023, and to wish you all a great summer. And we are now adjourned. Thank you all for being here.